All right, it's noon, so we are going to get started. Thank you everyone for joining us today for the Spring into Health event. My name is Haven Spanier and I'm the Senior Director of Programming at the U of SC Alumni Association. And it's my pleasure to get to introduce our host today. A few updates before we get started. First of all, I'd like to thank Prisma Health for making today's event possible. I also want you all to know that we want to hear all of your questions today. So if you have any, you can type them either into the chat or the Q&A features throughout today's event. If you aren't super familiar with Zoom, there should be a control panel across the bottom of your screen. There's a chat button and a Q&A button on that panel. Either one will work and you can type your questions there throughout the event. But without further ado, I'd like to introduce our host today. Jessica Justice Reath is a critical care certified registered dietitian and is the supervisor of the adult clinical RDs at Prisma Health Richland. She's originally from Columbia and graduated from Clemson University in 2012. Jessica then went on to complete her clinical nutrition internship at the Mayo Clinic in Jacksonville, Florida. She moved back to Columbia and started working for Prisma Health Trauma Team, where she has been for the past 7.5 years. Jessica's primary focus is in nutrition support, enteral and parenteral nutrition in trauma and surgical patients. She currently sits on the South Carolina Academy of Nutrition and Dietetics and serves on the Clinical Practice Committee for the American Society of Enteral and Parenteral Nutrition. Jessica lives in Columbia, South Carolina with her husband and puppy Lucy. And once the world opens back up, she looks forward to traveling again. So thank you so much, Jessica, for joining us today. We can't wait to hear from you.
All right. Thank you, Haven, so much. I'm excited to be here today, and thank you guys for having me. I'm looking forward to talking about what I do as a dietitian, which is a little bit different than what most people think dietitians do. And I also will be giving you some advice that the dietitians in the general nutrition world provide as far as tips for a healthier lifestyle. So thanks for having a Clemson Tiger here. I love Columbia. I love the University of South Carolina too. And I've just really enjoyed being part of this community. All right, as here at Prisma Health, I have been a dietitian, like she said, for about 7.5 years. I started when we were actually Palmetto Health. And then 3 years ago, Palmetto Health merged with Greenville Health and we became Prisma Health. Today, we are nearly 30,000 team members serving more than 1.2 million patients per year. And this includes 18 hospitals, around 3,000 beds and more than 300 physician practice sites. We are the largest health employer and second largest private employer. We conduct clinical research. We participate in technology and advancements with industry throughout our health sciences office of innovation and train the next generation of physicians and future medical professionals. We contribute close to $640 million per year in charity and unreimbursed care in our communities, plus another $170 million in community benefits. And our community really turns to us in times when the highest level of medical expertise is needed, such as complex care for trauma patients, our critical neonatal care, or leading the response to public health emergencies, such as recently the COVID-19 pandemic. We've successfully cared for thousands of COVID-19 patients in our physician practices, emergency and outpatient departments, and inpatient units, while continuing to provide urgent and emergent care to all of our patients in need. We also are proud to say that we continue to lead in administering the COVID-19 Pfizer vaccine in our communities with nearly 190,000 doses in arms as of mid-February, helping to save lives and protect South Carolinians against the coronavirus infection. We stand for accessibility, clinical excellence, innovative treatment options, and excellent patient experience. And we strive every day to inspire health, serve with compassion, and be the difference. So I'd first say that I am a critical care clinical dietitian that focuses on metabolic support for critically ill patients. I work in the intensive care unit feeding patients who are not able to take in a diet by mouth and require a tube or IV for nutrition support. I am also the clinical nutrition supervisor for the adult clinical RDs, and I'm in charge of establishing policies and procedures for all adult populations within the hospital, participating in quality improvement and safety management, and ensuring the RDs are maintaining hospital policy and continuing education. But the first question is how do you become a dietitian? So you must first complete a Bachelor's of Science in Food Science and Human Nutrition or a Master's in Food Science and Human Nutrition through an Ascend program. This is a program that requires you to take all the classes necessary for application to either the graduate program, if that is your next step, or if you finish your master's, a internship program. While you're in your undergrad or in your master's program, you should spend time volunteering in the hospitals and community setting to help get some experience under your belt. These internship programs are a match program similar to how a medical student matches for residency and are very competitive. So you want to make sure you participate in activities that will help you stand out. Most of the people who are applying for these programs have excellent GPAs and have worked very hard academically. So you want to have those extracurricular activities to help you stand out in those internships to separate you from others. In 2024, it will be required to have a master's before you can complete your internship. I did not receive my master's because I knew I wanted to obtain my certification in nutrition support, which is a little bit different route, but this will be required for any of the future graduates. Also note, your classes are very heavy in biology and chemistry, so prepare to like science. It's really not until your last year or in your internship that you're really exposed and start tackling nutrition coursework because of the amount of prerequisites that you have to do. We do have a good many of pre-med students who are in our Bachelor's of Science, Food Science programs, or also getting their master's before applying to med school. So like I said, it's very science heavy, a little bit of math thrown in there. But overall, you learn a lot, and it's a great opportunity to meet other healthcare professionals as well. The next step is a dietetic internship. This is where you'll participate in several rotations, learning from other RDs. Kind of like how physicians go through residency, this is the same thing that you have to do before you're allowed to sit for your RD exam. And what type of internship you do depends on your interests. There is a set number of hours in each area that you do have to complete. But if you're interested in clinical inpatient, then you're going to want to do a hospital-based internship. If you want to focus on community nutrition, you may pick a community-heavy internship. One of my colleagues who's actually here in Columbia, she wanted to focus on policy and government. So she actually did her internship in Washington, D.C., where she only did her minimum hours in the clinical and community setting and spent most of her time in the policy area. So you're exposed to all areas for at least 1 week or 2 weeks so that you have a chance to experience that job and kind of help you prepare for your not critical care boards. I'll talk about that in a second, but to prepare for your RD boards. So after your internship, you are allowed to sit for the RD exam and become board certified. Then once you pass that exam, you can apply for your state licensure and start practicing. The key is that you have to maintain your licensure and registration through continuing education credits. And this is around 75 hours for every 5 years. There's also a good bit of opportunity to obtain certificates based on your area of interest. I focused in nutrition support, so it took me about 2 years to prepare for my certified nutrition support clinician exam, but there are certifications in eating disorders, oncology, renal disease, diabetes, weight management. So you have the opportunity to really focus in on the area of your interest that you want to practice in. So this question comes up a lot, and I'm always asked to clarify what is the difference. The best way to explain this is all registered dietitians are nutritionists, but not all nutritionists are registered dietitians. Nutritionists do not have to complete the dietetic internship or complete the CDR exam with licensure. You just have to complete nutrition coursework, and then you can start practicing as a nutritionist. You also do not have to maintain continuing education units, such as a registered dietitian. You can still give nutrition tips and advice, but you cannot provide medical nutrition therapy, meaning you cannot prescribe macronutrients or micronutrients to treat a medical condition. For example, if a patient is diagnosed with diabetes or a feeding tube is placed for them to receive nutrition that way, a nutritionist cannot prescribe the diet or tube feeds. The patient would have to go to a dietitian. So that's kind of the difference. The word's really interchangeable for dietitians. I'm not offended if you say, oh, you're a nutritionist, because I am. I was a nutritionist when I graduated with my bachelor's degree and had taken my nutrition coursework prior to starting my internship. But that's kind of the difference out in the community so that people kind of have a better idea of what both do. And both are great. It just, again, depends on what you need as far as nutrition and health go as to who you would need to see. I know, I'm so sorry to say that, yes, I'm a Clemson Tiger, but like I said, I love Columbia and I do cheer on USC when you're not playing us. But I graduated in 2012 from Clemson with a bachelor's degree in food science and human nutrition. I did not pursue the master's route because at the time I wasn't really sure if I wanted my master's or if I wanted to sit for critical care boards later. So I went ahead and did my dietetic internship at Mayo Clinic in Jacksonville, Florida. I had the opportunity to take care of a wide variety of hospitalized patients since I chose a heavy clinical internship. I learned about nutrition support in critical care patients. I rotated through the trauma center at Shands there in Jacksonville. I got to work with specific GI conditions and diseases. And then I also had the opportunity to go to St. Jude's Children's Hospital in Memphis and rotate through pediatric oncology, because at the time I was a little interested and thought that that's where I wanted to go. It was a great month. I really enjoyed it. St. Jude's was incredible. It was a great learning experience. And I'm not in pediatrics anymore, but again, it kind of gave me a really good experience and exposure to that area. So after my program, which is usually a year, my program was accelerated and we actually finished in 9 months. I sat for this CDR exam and passed. I had an interview here at Prisma, which was Palmetto Health, the very next day, and the next week I was offered the job. I started helping to cover all floors for the various RDs when they took time off or needed help. This was a great opportunity for exposure to all adult populations and to get some experience. And then after a few months of floating through the hospital and seeing all these different types of patients, I moved into the surgery and trauma RD position full-time. And this is where I started in end of 2013, and this is where I've been since then. In 2015, I took the Certified Nutrition Support exam, which is again that critical care component, and passed and have maintained that. And so I have been working with our trauma surgeons, like I said, for probably about 7 years total, and we've got a great team here. We actually involved in multidisciplinary round with the pharmacist, and work with the residents here on service. And a lot of people ask, why is a dietitian needed in trauma, which I'm getting ready to talk about in a second. But if you're wondering, you're not the only one. My mother asks all the time. So before I can really explain what I do in a day and how I work with the trauma patients, I wanted to talk about the different types of medical nutrition therapy. And Haven and I were talking about this right before we got started, because it was even something she said she had not heard of before. And it's not something that most people in the general public know about unless you've been hospitalized and been exposed to it before. I routinely get from family members when I go to see my patients is, well, they don't need nutrition right now. They're too sick to worry about that. And that's not, not necessarily wrong. We understand that statement, but nutrition is crucial in any disease state or injury. Without nutrition while hospitalized or even just slightly sick, here, your mortality rate can significantly increase. In our trauma population, we have a 24 to 48 hour window to start them on nutrition support before we start to see the effects of malnutrition on healing and infection prevention. So a hospital RD will focus on all patients, whether they're on a diet, and we help to provide supplements like your Boost or Ensure that you probably see advertised, and snacks to ensure they're getting enough nutrition they need based around that disease state. You won't really see us focus on weight loss while hospitalized. I like to say, think of it more as an athlete that has a trainer and ensuring they eat properly for the sport they're training in. That's what we're doing in the hospital. Some chronic illnesses such as kidney disease and diabetes have very specific diets that we have to counsel patients on, and we have to monitor what they're eating to ensure that overall they're getting better. The main bulk of what critical care dietitians do is what we call nutrition support. And this is through enteral nutrition, which is where a tube is placed through the nose or through the stomach permanently, and the tube ends in the stomach. And a formula, which is very much like a blenderized shake with your macro and micronutrients, is prescribed daily based on your electrolytes, your respiratory settings, your medications that you're taking, and any surgeries or procedures that you're having. If your stomach does not work and you cannot tolerate eating anything by mouth or through the tube, we will place an IV and start what we call parental nutrition. And this is your protein, carbs, and fat broken down to its purest form, such as dextrose, amino acids, mixed oil emulsions, and we infuse it through an IV. And we add electrolytes and vitamins and trace elements daily, again, based on the overall condition of the patient. So it's a little bit like a pharmacist position because we have to be very careful in what we prescribe, and it's a daily monitoring. So any slight change will have to change what you're receiving around that. Like mentioned before, nutrition is crucial in critical illness. You do not get better without it, and you need it to start as soon as medically able. So the critical care dietitian will round daily with multidisciplinary rounds. We review each patient with the doctor, nurse, and pharmacist to form treatment plans on a daily basis. When we're first seeing a patient, we have to do a thorough assessment by obtaining diet and weight history and completing a physical exam. We have to determine the nutrition status prior to admission, especially if the patient is coming to the hospital already malnourished. Each prescription and plan is very individualized based on the patient's condition, ability to wean off the breathing machine and other forms of life support, and if they will have surgeries or injuries to overcome. We have an overlying guidelines that kind of help provide an idea of how to treat each condition, but each patient will receive a different prescription and could have as many changes as they do as days in the ICU. My mom sometimes jokes that she must think I'm like Oprah, where I'm passing out like, you get 1,200 calories and you get 120 grams of protein, but it's very careful math, which is again something you must like as a dietitian, and a science to how your body is utilizing those nutrients when it's in this high inflammatory state and when it is sick. And it's something we face, challenges every day with, is whether or not the patient's gut is going to tolerate what they're feeding them. What effect is the surgery or the form of life support going to have on the patient and their ability to utilize nutrients? So we pull a lot of biochemistry and organic chemistry out of our back pocket on a daily basis as well. And not only do we participate in patient care, but we are constantly reviewing our outcomes for quality improvement and patient safety. We sit on many committees with all healthcare professionals reviewing our patient care plans and how to improve patient care. We participate in research, especially being a teaching hospital. We're constantly working with our residents and our physicians on training, and also training our internships. And then again, like I said, we participate in research and working on publications. I've been fortunate to be involved in 2 projects and publications that have been leading the way for critical care nutrition. So that's something we never forget to do. And then we precept the interns that join us for their dietetic internship to prepare them for becoming dietitians. A lot of people ask us how COVID changed, and for us, it was a great deal. We were on the front lines with respiratory therapists, nurses, doctors, and pharmacists. Last April, I actually spent the whole month working our COVID unit and treating our COVID patients. We faced significant challenges with these patients because we had not seen this disease before, and the metabolic effects it had on the patients were very widespread. We had an increase in ventilators and dialysis patients, which require more enteral nutrition and specific prescriptions, along with some GI side effects that happened with our COVID patients, causing us to have to prescribe more parental nutrition, or that IV nutrition. We talked about it. Nutrition assessments on patients became much harder. If a patient cannot tell us about their nutrition status, we were usually able to talk with family or friends at bedside. But since we had to adjust our visitor policy, we weren't able to meet with them and really find out what was going on with our patients prior to coming in. And a lot of them experienced those respiratory changes. So having conversations with us about how well they were eating, if they had had any weight loss prior to coming to the hospital, was very difficult. We also had to preserve PPE. Obviously, our visits into our patients' rooms had to be very selective, and our full physical exams could not always be completed. Now, as COVID went on, we were able to get more supplies in, and it's not a concern anymore, and we are able to go in their rooms fully donned in our PPE, but that was in April a big challenge for our unit. Our staff also became sick or had family that was sick that prevented them from coming to work. So we were short-staffed, or we had to move staff around to cover areas they normally would not. RD practice is very specialized. What I do as a critical care dietitian doesn't mean that every dietitian in the hospital can do critical care, just like I can't do every renal patient or every diabetes patient, because we have specific dietitians that cover those areas. Because we were short-staffed and because our critical care load was significantly increased, we had to bring those dietitians from other areas to come help cover. And we really had to do a crash course of how to take care of these patients. So that was another challenge that we faced. Just like doctors and nurses were shifted to cover other units, so were we. Another challenge we faced were supply chains. We had significant shortages of enteral and parental nutrition that presented new challenges when providing care. We saw a significant decrease in the ability to get vitamins and minerals because remember when there was a big promotion of taking your vitamins to prevent COVID, that actually has a big effect on us in the hospital and the ability to provide it to patients who cannot eat or take that supplement by mouth. And then just like other areas of healthcare, simple things like tubing or bags started to become short. So that presented its challenges in itself with our enroll patients. I will say, telehealth was a positive to come out of COVID, and we are actively working with our state legislation right now to make this a permanent fix. Our outpatient RDs were able to meet with their patients and provide care through telehealth, which we saw an increase in compliance. And we were able to keep our patients safe by allowing them to stay at home. So this is something that our hospital is really trying to help and encourage. This way we can really reach out to our patients who have difficulty maybe coming to Columbia or getting to the hospital because of their condition, or they may not have family members that can bring them to the doctor's offices or the dietitian's offices. So this was a positive that's come out of it, and we're really working to make sure this is something our insurance companies continue to cover and that we can still provide to our patients. Overall, though, I'm extremely proud of our dietitians and the challenges we faced during COVID. We have had a significant increase in our workload over the past year. I will say hug a healthcare professional because our hospitals have been busier than ever. Once we got through COVID, we had an influx of just our patients who were sick, who hadn't come to the doctor in a while or come to the hospital to get checked in. And so we were balancing sick patients who didn't have COVID and our COVID population. So they've just done an incredible job overall taking care of everybody. And I couldn't be prouder of our teammates. Okay, so I was asked about dietitians' tips for a healthy lifestyle, and I will admit, as a dietitian myself, I had to do a little bit of research since I'm pretty far removed from outside of the hospital, and most of my patients, like I said, are on enteral and parental nutrition. But like I mentioned earlier, this is just kind of some general tips. I talked to my dietitian colleagues in the community about what they're promoting in their outpatient offices and within their wellness groups. But they've really wanted me to make sure, we don't necessarily focus on weight loss as much anymore. Like I said, we don't focus it on the inpatient side, but in the outpatient world, you're finding more dietitians really encouraging the practice of intuitive eating. I am someone who can remember my grandmother and my mother being on different diets growing up because that was the fad and the encouragement from the healthcare industry. And we've really started to see the effects this has had on people's metabolisms and their overall health. This past encouragement of rapid weight loss and extreme dieting has led to some significant health concerns. It can drastically affect your metabolism, which makes it harder to keep the weight off or lose the weight in the future. So dietitians have been working with physicians and other healthcare professionals to reshape health and not focus so much on image or the scale number. Knowing that one size does not fit all is key, and understanding the person's overall body habitus. We want to encourage an increase in muscle mass, and we want to focus on types of food the patient is eating, but also the types that they have access to, versus maybe that encouragement of a fad diet that will give quick results. A perfect example is how BMI was used in health. It was actually a mathematical equation developed by men in the 1800s. It does not take into account your muscle mass or fat mass, and it can be very deceiving. One example I like to use is Halle Berry was actually classified as obese when she was trying to build up her muscle mass for a movie. And she is not someone who's obese. She just had an increase in muscle mass, which did increase her weight, but moved her on that BMI scale. So we really want to shift that thought that someone has to be a size 0 or 2 or that low BMI, and focus more on how can we make sure that this person is healthy? How can we incorporate what their daily habits, their movement, access to food, to ensure that overall they are a good picture of health versus maybe a certain weight. So we try incorporating well-balanced food groups. We encourage cooking as not only access to healthy food, but as a social opportunity with family and friends. Everything in moderation is still a popular message, but really also paying attention to what makes you feel good. Are we eating because our body needs energy, or are we bored? Do we need food today because we've been very busy and we haven't had the chance to eat? Really connecting food with our setting and body versus restricting ourselves and focusing on only eating these types of food groups. This won't give you a rapid, quick result, but we don't want rapid and quick. When we have rapid and quick weight loss, this is a loss of muscle mass, and it can cause significant alterations in your metabolism, actually lowering it. So we don't want, again, that rapid and quick weight loss. We really want to focus again on how we can overall shape our health. How can we build that muscle mass? How can we focus on our cardiac health? How can we focus on maintaining good blood sugar control if we're someone who is at risk for diabetes or someone who has diabetes? You know, what are those types of foods we need to focus on incorporating? And then also exercise. It's something that's changed drastically over the past year with COVID and our inability to maybe go to the gym or having to maybe do more walks or runs outside. And we always know that exercise has been a challenge when someone is focusing on their health. And one thing that we try to encourage as dietitians is not necessarily a HIIT program or an extreme Biggest Loser challenge, more of a focus of movement and how do you incorporate it into your daily routine. By paying attention to your body, you'll start to see days in which you're craving fruits and vegetables and crave a really hard workout, but then also giving yourself peace when you want to enjoy Thanksgiving with the family and just walk around the neighborhood or take a nap on the couch. The idea of restriction and strict programs has evidence to show a yo-yoing effect in disordered eating. So we really want to work to change into something that is sustainable and enjoyable to promote health. You know, how can we incorporate this into our daily lives so that we sustain it throughout our entire life instead of focusing on how much weight can I lose and what's that scale going to show? All right, well, I want to thank you guys for allowing a Clemson Tiger to share today about dietitians. This was a field I didn't really know much about. I actually went to Clemson to pursue a medical school route and came up on my first nutrition course. I was continuing to be amazed at the careers that were open for RDs, and we really do have the opportunity to help improve health, whether it's through counseling, policy navigation, or clinical work in the hospitals. I'm very proud to be a dietitian, and I'm always willing to talk with anyone who's interested in becoming one. I hope I do not see any of you as my patients in the trauma world, but if you're looking for an RD in our community, I can definitely assist you with finding one. We have a great community here in Columbia, and just a great group of dietitians to work with. So Haven, I will pass it back over to you.
Thank you so much, Jessica. That was a great presentation. All right, if you all have questions, now is the time for those. So you can either type them into the chat or into the Q&A. And just a reminder, if you weren't super familiar with Zoom, across the bottom of your screen, there should be a chat button and a Q&A button. So type away, send in your questions. We want to see as many of those as possible. All right. One question is about elimination diets. So if you've been struggling with food allergies, would you recommend doing an elimination diet and then reintroducing the foods to see if you can identify what is not agreeing with you?
Absolutely. And that is something that within our GI conditions that our dietitians focus on. I'm actually a dietitian that can speak from experience. I was concerned that there was a food causing bloating and problems when eating, and really couldn't pinpoint which one it was. And so talking with our GI dietitian, eliminating those foods, most specifically gluten, dairy, are your two main food groups, and then any of your higher fiber foods, such as some of your vegetables that might be harder to digest, are kind of areas to start and try that for about 2 weeks, and then slowly incorporating them one at a time back into your diet. And that will help you kind of narrow down again which food may be causing those symptoms. For me, it turns out it was gluten, and I then went on to see a gastroenterologist who did all the tests to help us determine exactly what it was. But that elimination diet was very helpful in figuring out the symptoms. So again, eliminating those foods and then one at a time incorporating them back in will help you figure out which one's causing your symptoms.
Great, thank you. This next one is kind of going off of that. So if you have a food group, for example, dairy, that doesn't necessarily agree well with you or hasn't in the past, do you have to eliminate that forever? Can you start to reintroduce that into your diet?
It's a really good question, and it's very individualized. And so it is something, if you were wanting to eliminate all dairy and then slowly incorporating certain things back into your diet, you could determine which one triggers your symptoms. An example is I've had very few patients who will also tell me that they eliminated dairy completely and they started incorporating different types of cheeses. And some cheeses they can eat and some cheeses they have to avoid. I've had some people who tell me it's just milk. They can't drink any type of lactose product, but they can eat cheese, they can eat yogurt, and some ice creams they're able to tolerate. So It is very individualized, but if it's something that you want to bring back into your diet, again, it's that one at a time and just focus on your symptoms.
All right, thank you for that. This next one says, I've been following an intermittent fasting and low carb eating plan. I've noticed some muscle mass loss while losing weight. What would you recommend to help prevent muscle loss as I can pursue weight loss?
It's a very good question, and one that we get quite a bit, and one that a lot of people don't realize. Unfortunately, in the health industry, we've always promoted as carbs as something that's been bad, but your body needs a certain amount of carbs for energy. It is one of our biggest energy sources. And so you really want to make sure that you're eating enough carbohydrates to preserve the muscle mass. And the reason for that being is if you're eating too few of carbohydrates, you're eating mostly protein and fat, your body is going to use that protein and fat as an energy source versus helping you to build muscle. And so you want to eat enough carbohydrates to provide energy to your body and then allow that protein to be contributed to building muscle mass or maintaining muscle mass. And so typically we would recommend at least 50 to 60% of your energy source be carbohydrates. And it's not necessarily sugar. You're looking at things like whole grains, fruits, starchy vegetables. Those are great ways to get that carbohydrate in so that it contributes to the right energy source within your body.
Thank you. And then going off of that, I'm not sure if this is your specialty since you're normally in trauma, but you could give us some advice on intermittent fasting windows. What would be like the optimal time if someone was trying to follow that plan, and does that vary at all?
It's going to be very individualized. And the reason we say that is that your body already kind of intermittent fasted at night when you are sleeping. And so what we recommend is that you really listen to your body's cues and don't ignore your hunger cues. That's one of the biggest mistakes people can make with intermittent fasting, is that they wait too long. And when they're hungry, they're ignoring it, waiting until a specific time. So the recommendation is that it's really individualized based on how you feel. And to be 100% honest, it's going to probably vary from day to day. Some people will report that some mornings they wake up very, very hungry, depending on how well they slept the night before, or maybe what they ate or their activity the day before. And so they're not able to wait for a certain amount of time. They do want to go ahead and have breakfast and go about eating the normal meals throughout the day. And there's some people who wake up in the morning and just say, I'm not hungry until noon. I didn't have much going on, or my body didn't indicate to me that it needed to eat something for energy. And so I waited until noon or 1 o'clock to have a meal. So it's very individualized, and you really want to listen to your body and not ignore those hunger cues. And you also want to be providing enough energy, especially if you're doing exercise in the morning, or you're planning to do a very big workout. You want to make sure you're providing enough fuel for your body so that you can fuel that workout and then promote that weight loss afterwards.
Great, thank you so much. All right, another thing that we've been hearing a lot lately is keto diet. I'm wondering if you can explain what that is, and then the benefits and the drawbacks of it.
All right, well, the keto diet was actually designed for children with seizures to help control and reduce the amount of seizures they were having by reducing the amount of sugar intake. And so it's a focus on a high fat diet with a moderate amount of protein and then low carbohydrate. To be 100% honest, as dietitians, we don't actually promote the keto diet because it is used for medical treatment in the hospital, specifically for epilepsy, because unfortunately it doesn't provide you with enough energy from other sources such as protein and carbohydrates. One effect is that it will have a significant blood sugar control, and you will see weight loss happen pretty rapidly. But the second you start to try and incorporate any type of foods back into a normal diet, you're going to see the rapid weight gain occur, and it could also occur as a fat mass gain versus a muscle mass gain. And the other piece of it as well is that it's a specific fat prescription to follow, and a lot of people end up eating too much fat in their diet by trying to switch to keto. So it's not something we necessarily recommend. I do encourage you, if you're thinking about going on keto, to reach out to a dietitian and talk with them about how to balance it correctly. If it's, a focus on maybe just wanting to spread your macronutrients out to a more appropriate level, that's what a dietitian will work with you on, and kind of help encourage to ensure you've got enough of the other food groups in to prevent those rebound effects that the keto can have. It's a good question. It's very popular. We get that question a lot.
Thank you for that one. All right, the next question is advice on counting calories, good or bad?
Well, I will tell you, the concept of calories in versus calories out is always the same, and that is what's going to contribute to weight loss. And I do want to say there is nothing ever wrong with wanting to lose weight, especially if you're looking at it from a health perspective. And so, tracking calories can again become very tedious and can lead to restrictions. It's not necessarily something that we encourage or that we focus on. I came from the dietitian world where we were taught all about MyFitnessPal and tracking calories and that sort of thing. We have found great success with that program. The concept is to more focus on what type of foods you're eating and dense calories. Are these empty calories versus foods that are maybe high in sugar, high in fat that don't really help sustain fullness versus foods that provide you a good amount of energy. And are those denser calories that help keep you fuller longer or provide energy to fuel workouts or if you're working, such as like studying. So that's more of our focus on the calorie shift versus necessarily how much calories in versus calories out.
Okay, the next question, do you have any advice on getting through a weight loss plateau?
So the biggest advice I can give is make sure that you are eating enough. Sometimes what happens in our weight loss journey is that we are restricting a little too much. And so sometimes that can cause that plateau to happen because our body is trying to hang on to energy because it's been restricted too much. So my advice would be to reach out to a dietitian, talk to them about your goals. And what they can do is help prescribe enough calories that will still help you with your weight loss goals, but also make sure that you're getting enough fuel for your body based on what you do each day.
Shifting back a bit to what you do in your job, what's your favorite part of your current job?
My favorite part is getting to see kind of the results that nutrition brings, especially in the trauma and surgery world. A good many of our patients are young, 25 to 45 is the average age of your trauma population, and they sustain injuries that really prevent them from their day-to-day activities, and getting to work with them and help rebuild muscle mass, work with them on returning to their daily function, just by providing nutrition that they weren't necessarily thinking something would ever need, has been the most rewarding experience. One of my patients that I still see today, he comes to the hospital to say hello to us, was a boxer who was in a car crash. He stepped off the street and unfortunately was hit by a car. And he was on multiple forms of life support. He was with us for about 3 or 4 months. And as you can imagine, as a young boxer who had high amount of muscle mass, was used to a very specific nutrition regimen, having a feeding tube was very hard for him. And I worked with him each day and his mom each day to help provide nutrients to get him through his critical illness and through all of the surgeries that he had to have. And then I worked with him as he worked with his physical therapist and his occupational therapist to build back his strength and return to his function. And he is now back to boxing full time. He had his ostomy reversed. And he and I talk frequently about the importance of nutrition. So really getting to see the impact nutrition has in the trauma and surgery population, and working with patients as they go from being the sickest and bedbound to then getting to work with therapy and go back to walking again or returning to daily life. So that's been the most rewarding and my favorite part of the job.
Wow, that's an incredible story. Okay, the next question, shifting gears again. Does it matter how I time my food intake to my workouts?
It does a little bit. Again, I always hate to say it's very individualized, but how you feel. Some people are able to eat within that 15-minute period and it not make them feel bad when they're working out. I am not one of those people. A general rule of thumb is to make sure you've had some form of quick energy an hour before you work out, and that you have eaten some form of long-lasting energy after you work out. So the best example is like a quick energy source would be maybe eating a banana with a little bit of peanut butter. You don't want any type of heavy, dense protein on your stomach. You don't want heavy, dense carbohydrates on your stomach that are hard to digest right before you work out. So you want to eat something that's going to metabolize quickly and give you a quick burst of energy, such as something like a banana, piece of fruit like an apple or an orange is always a great option. And then after your workout, within that hour, you want to eat something that's going to be higher in protein and give you that energy that's going to sustain you a little bit longer. So an example is something like chocolate milk is a great energy source because it's got the carbohydrates to replete you post your workout. And then it has that protein to help rebuild your muscle mass back up. But an hour before and an hour after is your general rule of thumb.
For those who like to work out first thing in the morning, do you still recommend them eating prior to working out if they can't wait the full hour?
Yes,
for their workout?
I would still recommend. I do a 5:30 a.m. workout, and I'm usually 15 minutes before eating something like a banana before I work out. So, something kind of quick like that piece of fruit that's not going to make you feel very heavy on your stomach is the best thing to do, even if it's right before.
Thank you. All right. What is your advice if someone is dealing with an eating disorder? How to work through that?
That is a very, very hard disorder to work through. I understand completely. And my best recommendation is a dietitian. We're not all trained in eating disorder management, but we have some great eating disorder dietitians within South Carolina who work very hard to work individually with each person through the counseling portion of it, through talking about working through the food fears, working through making sure they're getting enough calories and protein and fat and carbohydrate with a specific meal prescription. So really reaching out to a dietitian who focuses on eating disorders would be my best recommendation.
Thank you. And I know that you touched on this one a little bit in your presentation, but what would be your advice if someone's interested in pursuing a career in nutrition or as a clinical dietitian?
Yes. First, I would try to see if you can shadow a dietitian in an area that you may be interested in, or shadow several dietitians. We do love to take people on for the day. We are finally kind of getting back into that with COVID. I can't speak for every hospital, but I know a lot of the hospitals around the area are trying to bring back in shadowing opportunities. Look at the outpatient dietitians as well. That's immediately what a lot of people think of is when they think of dietitian, they think of an outpatient dietitian who has an office, who's working with people on weight loss management, but we're in all areas as mentioned before. So shadow a few different dietitians, talk to them about those of us that went through the 4-year bachelor's degree, or those of us that went through a master's program. They might have had a bachelor's degree in something else, but went through the master's in food science or master's in public health and nutrition, which I know is offered at USC, and then went the route of the Dietetic Internship. And they can also talk to you about the different programs. We've had some who this is a second career for them, and they were working while they were doing a distance internship program. So there's a lot of different opportunities. We didn't have all the same path. And so I would recommend reaching out to one who can help connect you with several others. I'm more than happy to do that for anybody who's interested today, and talk to them about their specific journey and how it may help if you're looking into it, work with your situation.
Great. Well, thank you so much, Jessica, for your time. It looks like we got to everyone's questions. If you have a last minute burning question, quick type that into the chat. But I appreciate your time. Thank you everyone for joining us for today's Spring into Health event. I know I learned a lot. I hope you did as well. We'll be sending this out in a recording. If you want to go back to anything that Jessica talked about today, there'll also be a survey in that email. And then if you all are interested in any of our other Spring into Health events with Prisma Health, you can register for those at ufscalumni.org/events. But thank you again to everyone for joining us. And thank you so much, Jessica, for your time today.
Thank you guys. It was a great opportunity and I look forward to working with you more. Thank you.
Thanks, y'all.